The respiratory system is a complex network of organs and tissues responsible for the exchange of oxygen and carbon dioxide within our bodies. It plays a vital role in maintaining our overall health and well-being. As nursing students, understanding the respiratory system is crucial to comprehend respiratory conditions and provide optimal patient care. The process of respiration begins with the inhalation of air through the nose or mouth. The air passes through the pharynx, or throat, and enters the trachea, also known as the windpipe. The trachea further divides into two smaller tubes called bronchi, which then branch out into smaller passageways known as bronchioles. At the end of the bronchioles, we find tiny air sacs called alveoli. These grape-like structures are where the actual gas exchange takes place. Oxygen from the inhaled air diffuses across the thin walls of the alveoli into the surrounding capillaries, where it binds to hemoglobin in red blood cells. Simultaneously, carbon dioxide, a waste product of metabolism, diffuses from the capillaries into the alveoli to be exhaled. To facilitate the movement of air, the respiratory system also includes a set of muscles. The diaphragm, a dome-shaped muscle located below the lungs, plays a crucial role in breathing. When we inhale, the diaphragm contracts and moves downward, expanding the thoracic cavity. This expansion lowers the air pressure in the lungs, causing air to rush in. Conversely, during exhalation, the diaphragm relaxes, allowing the lungs to recoil and expel air. The respiratory system works in close coordination with other body systems. The cardiovascular system, for instance, carries oxygen-rich blood from the lungs to the rest of the body and returns carbon dioxide-laden blood back to the lungs for elimination. The nervous system helps regulate breathing by controlling the rate and depth of respiration based on the body's needs. In summary, the respiratory system is a complex network of organs and tissues responsible for the exchange of oxygen and carbon dioxide. It involves the inhalation of air through the nose or mouth, the passage of air through the pharynx, trachea, bronchi, and bronchioles, and the exchange of gases in the alveoli. The diaphragm and other respiratory muscles aid in the process of breathing, while the cardiovascular and nervous systems work in conjunction with the respiratory system to ensure efficient gas exchange. Now, let's discuss some common respiratory issues. COPD, chronic obstructive pulmonary disease. COPD is a chronic lung disease characterized by persistent airflow limitation. Symptoms of COPD include shortness of breath, coughing, wheezing, and excess mucus production. Common medications used for COPD treatment include bronchodilators, such as short-acting or long-acting beta-agonists and anticholinergics, to open up the airways, inhaled corticosteroids to reduce inflammation, and combination medications that contain both bronchodilators and corticosteroids. Other medications like phosphodiesterase 4 inhibitors may be prescribed in specific cases. Asthma. Asthma is a chronic respiratory condition characterized by inflammation and narrowing of the airways. Symptoms of asthma include recurrent episodes of wheezing, coughing, shortness of breath, and chest tightness. Common medications used for asthma treatment include bronchodilators, such as short-acting or long-acting beta-agonists and anticholinergics, to relax the airway muscles and relieve acute symptoms. Inhaled corticosteroids are often used as maintenance therapy to reduce airway inflammation. Combination inhalers that contain both bronchodilators and corticosteroids are also commonly prescribed. Chest trauma. Chest trauma refers to any injury or damage to the chest area. Symptoms of chest trauma can range from mild to severe, depending on the extent and location of the injury. Treatment for chest trauma depends on the specific injury and may include pain medications, such as nonsteroidal anti-inflammatory drugs, NSAIDs, or opioids, to manage discomfort. Other interventions may involve antibiotics to prevent infection, cough suppressants, and medications to support respiratory function or stabilize blood pressure. Pleural effusion and empyema. Pleural effusion refers to the accumulation of fluid in the pleural space, while empyema is a type of pleural effusion that becomes infected. Symptoms of pleural effusion and empyema include chest pain, shortness of breath, cough, fever, and general malaise. Treatment for these conditions involves addressing the underlying cause, such as infection or inflammation. Medications commonly used include antibiotics to treat infections, diuretics to reduce fluid accumulation, and pain medications for symptom management. In some cases, surgical intervention may be necessary to drain the fluid or remove infected tissue. Acute respiratory failure. Acute respiratory failure occurs when the lungs fail to oxygenate the blood adequately or remove carbon dioxide. Symptoms of acute respiratory failure include severe shortness of breath, rapid breathing, confusion, cyanosis, and an increased heart rate. Treatment for acute respiratory failure often involves mechanical ventilation to support breathing and maintain oxygen levels. Medications used may include bronchodilators, corticosteroids, antibiotics if there is an underlying infection, and medications to address the underlying cause or associated conditions. Acute respiratory distress syndrome, ARDS. ARDS is a severe lung condition characterized by widespread inflammation and injury to the lungs, leading to respiratory failure. Symptoms of ARDS include severe shortness of breath, rapid and shallow breathing, low oxygen levels, and a rapid heart rate. Treatment for ARDS focuses on supportive care, including mechanical ventilation with low tidal volume and positive end expiratory pressure, PEEP, to maintain lung function. Medications may include sedatives to keep patients comfortable, neuromuscular blockers to reduce the work of breathing, and medications to address the underlying cause or associated complications. Pulmonary embolism. Pulmonary embolism occurs when a blood clot travels to the lungs, blocking one or more pulmonary arteries. Symptoms of pulmonary embolism can vary but commonly include sudden onset of shortness of breath, chest pain, cough, rapid breathing, and a rapid or irregular heartbeat. Treatment for pulmonary embolism often involves the use of anticoagulant medications to dissolve or prevent the formation of blood clots. Thrombolytic therapy, which involves medications to break up the clot, may be used in severe cases. Other interventions may include pain medications and supplemental oxygen. Occupational lung disease. Occupational lung diseases are respiratory conditions caused by exposure to hazardous substances in the workplace. Symptoms depend on the specific disease but can include coughing, shortness of breath, wheezing, chest tightness, and fatigue. Treatment for occupational lung diseases involves removing the individual from the exposure source and providing supportive care. Medications may include bronchodilators to alleviate symptoms, inhaled corticosteroids to reduce inflammation, and medications to manage associated conditions or complications. Chest trauma. Symptoms of chest trauma can vary depending on the specific injury. Common symptoms include chest pain or discomfort, difficulty breathing, rapid or shallow breathing, coughing up blood, visible deformities in the chest wall, and bruising or swelling. Treatment for chest trauma varies depending on the severity and type of injury. Medications commonly used include pain medications, antibiotics if there is an infection, and medications to stabilize blood pressure or support respiratory function. Surgical intervention may be necessary to repair damaged organs or blood vessels. Please note that the medications mentioned here are general examples and may not be suitable for every individual or circumstance. It's essential to consult with healthcare professionals for accurate diagnosis, personalized treatment plans, and ongoing care.